suddenly I started having terrible senses, terrible smells, and terrible tastes of things that should taste and smell good.
Hello everyone, Dr. David Kulla here with Synergy Wellness in New York City. We have another case of someone who has had COVID and not only has lost her sense of smell, but it gets worse. And she's going to tell you about that right now. So why don't you go ahead and explain what's going on with you.
A very mild case of COVID back beginning of March, end of April, end of February.
Mm-hmm.
And recovered very quickly, and I did lose my sense of smell for a couple of weeks, and then it came back. And sense of smell and taste came back, I would say 100% for several months. Starting in July, I started getting some strange smells. I thought there was something wrong with the tap water. I thought that my dryer was having, there was like lint on fire in the dryer. There was strange smells coming from places that normally have none. And then it took a little bit longer, and then in the middle of October, suddenly I started having terrible senses, terrible smells, and terrible tastes of things that should taste and smell good. It's called parosmia, and what it is it's a distorted sense of smell and taste. So a piece of chicken, which would normally taste delicious, tastes like it's rotten. It's really, really vile. Things that you take for granted, just I think maybe I'll just have a salad. Well, the salad dressing tastes like it's putrid.
Okay.
Yeah, a lot of a sense of rotting garbage. And what I've been able to read...
Can you imagine that, folks?
Yeah.
Eating food and it smells and tastes like rotting garbage.
Like rotting garbage.
Having a steak, biting into it. I think you said that you would bite in a bite or two, you would be fine. And then after third or fourth bite or halfway through it, it would just smell putrid.
That did happen once. For the most part, I've just learned that there's certain foods I can't have. That I'll actually end up needing to spit them out. I can eat certain things without any trouble. A plain avocado, a very simple, some yogurt, cheese, plain cheeses. But most foods have a very distinct smell that's really awful, and even though you look at it and it looks good, it looks like something you want to eat, as soon as you smell it,
because you're used to liking that food.
a piece of pizza. My husband came home with pizza the other night, and I had to leave the room. It just really smelled awful.
It smelled so bad.
It smelled so bad, yeah. So I'm trying very hard to just find what I can eat for the time being, and hopefully this will pass.
Yeah, so as you can see, she's desperate. There is no known treatment for this that we know of until now. There's been some reports of chiropractic upper cervical work helping with the loss of smell, but not the parosmia, right? So that condition changes everything, really. It makes things much more serious. So we need to go over that and how we treat that. So I'm going to have you lay on your back. Okay, so what we're going to do differently than we did with her husband is this is a much more complicated case, right? And so what I'm going to do is I'm going to go ahead and stimulate her olfactory nerve through the nasopharynx, through the nose. Okay, so we're going to stick this probe here. It's not that big. It looks bigger than it is. Up her nose, and we're going to keep it there for a couple of minutes. We're going to stimulate the olfactory nerve. Now, she had mentioned, go ahead and put that on. She had mentioned about her sense of taste, not just her sense of smell, but sense of taste also controlled by the cranial nerves. So when we talk about cranial nerves, those are nerves all the way up in the skull area, and those nerves control a lot of different things, senses. I won't go into all the different things that the cranial nerves control of body functions, namely taste, the hypoglossal nerve, smell, among other things. And the way that it does that, the brain, we smell something, we then, it goes through the olfactory nerve into the brain stem. The brain interprets that and then sends a signal back, and we're able to interpret that like, oh, that smells like coffee, or or it smells like garbage in her case. So that's sort of a basic explanation of how cranial nerves work, how our nervous system works. Okay, ready?
Yeah.
So for you folks out there watching, this is not painful. In fact, she doesn't feel anything other than the probe in her nose. And we're going to go ahead and do this for a few minutes on each side. How you doing? Okay? You might feel your nose start to run a little bit, like a runny nose. And you'll notice here I'm kind of putting the laser at different angles because I want to make sure that I hit the olfactory bulb. The olfactory bulb is all the way up at the very, very top of the nasopharynx, and I don't want to miss it. So I'm using all different angles.
I feel like I'm going to sneeze.
You got to sneeze?
Oh, no, not now.
Let me know if you need to.
Okay.
And with this laser, we're able to stimulate, and we're also able to inhibit nerves. So now this is, again, experimental. We're going to follow up with her afterwards, maybe later in the week or next week, to show you folks how she's doing, okay? This is her first adjustment, her second visit. First visit, you just had an adjustment to the upper cervical spine, and there was no change. Is that right?
Right.
Yeah, so no change for her. Her husband had some positive changes, but none for her. So that's why we're doing the laser here. And again, we're going to follow up. You okay?
Yeah. Go to sneeze. Oh, excuse me.
Okay, no problem.
Oh,
God bless you.
thank you. My goodness.
Okay.
Now, how do we know that this is going to stimulate or not the opposite?
Well, I'm using a frequency to stimulate it.
Okay. As you had said, sometimes it can.
You can inhibit too, yeah,
Right.
depending on the frequency we use. Yep. Okay, now we're going to go to the other side, okay?
Yeah.
And again, here on this side, I'm going to just use some different angles just so we make sure that we shine this laser light directly onto the olfactory bulb. The olfactory bulb, it's like the thickest part of the cranial nerve. As I said, it sits right up here at the top of the nose in the nasopharynx. Let me know again here if you need to sneeze. And then after this, we're going to go ahead and do an upper cervical adjustment for her as well, using the ARTHROSTIM. Again, you could use many different instruments for upper cervical work. You can even use your hands for upper cervical work. But in this situation, we're going to use the ARTHROSTIM. May need to sneeze.
No, it's just a little uncomfortable.
Okay. How's that, a little better?
Yeah, yeah, it's better.
So all I did there was just pull back out of the nasopharynx just a little bit for her. And when doing laser, you never want to look into the light. I'm looking away, if you notice. It's not good for your eyes. She's got glasses on, safety glasses. If you guys have any questions or comments about, well, COVID, I'm not a COVID specialist, but about anything we're dealing with here, feel free to comment below. I'd be happy to answer your questions if I can. If I can't, I'll tell you I can't, okay? So far, so good?
Yeah.
Good. So our cranial nerves control not only smell, but sense of taste, right? So if you eat something like a bad clam or a bad fish, immediately you'll have this reaction and you'll spit it out. And that's the body, the brain interpreting the taste of it through the cranial nerves and then eliciting a response by spitting it out. So, okay. And your glasses, I'll take those back and you can put your mask back on. All right, take a look now. We're going to do an upper cervical adjustment for her. So go ahead and lay down on your stomach. And there's some arm rests right there. So as I said, we're going to do a follow-up video later in the week or next week just to track their progress, both her and her husband, and see how they're doing. And we'll try to add it to the end of this video. If not, we'll do a separate new video. But I do want you guys to follow up on this case as I will too. And okay, go ahead, take a deep breath in and blow out. So to me, it feels like she has a little bit of scoliosis, but that's not what she came into me for upper back or neck pain. But I do notice a little bit of asymmetry. If you want to come here, you can feel what I'm talking about. Feel, if you put your hand here, feel how the muscles are more pronounced on this side than they are on this side. And it rises up here on this left side.
I can actually see that.
Yeah, you can see it too. It's not a lot, you know, but it's enough to feel and to, if you're really looking for it, to see it. Yeah. So that tells me she probably has a thoracic or a cervicothoracic scoliosis, a lateral curve to the spine. And we're not going to correct that today or in the next year or two. At her age, it's just not going to happen. I had scoliosis. I had mine corrected at 15. When my bones were still growing, I didn't even have, I think my growth plates weren't even finished growing yet, so I had time on my hands. She doesn't, so. But we're going to correct some of these misalignments because that causes the neck to come out of alignment too, or to compensate. So go ahead and turn over on your back for me. It's Andre, right?
Yep.
Okay. And cross your arms in front of you. Okay, tuck your chin down, take a deep breath in, and then come on up, half a sit-up for me. Yep, and blow all the way out. Good. And another one, deep breath in, and blow out, and drop your head back. Okay. And slide up towards me. And of course, not a lot of motion in her upper thoracic spine where I just adjusted. It's been like that since she was probably an adolescent. Scoliosis develops at the age of, you know, give or take 11 years old. But I can definitely feel that. You feel that? Stiffness.
A little bit, yeah.
They've both had some stiffness in the neck. Nothing debilitating, right?
Definitely not.
Almost quicker than she did, it feels like to me. And okay, so we're going to do a couple of adjustments here. Some are going to be upper cervical adjustments. So in the cervical spine, we have 7 vertebrae. So we're going to adjust the lower cervical vertebra here for her. Okay. Are you sensitive right there?
Not really.
Or here?
I can feel it. It's
Left side or the right side?
both. A little sensitive. Just
Is
like
it
your
more so sensitive on one side compared to the other?
left side.
Okay, lay on your right side. And slide down for me. Slide up. Okay, slide down about 1/4 of an inch to 1/2 inch. Yeah, too much. Come up a little bit. Okay, right there is good. Yeah. So this is the instrument we use called an ARTHROSTIM, and you can change the strength of it. It's on a motor. There are other instruments that just do one tap at a time. And you can see I have it tilted at an angle for a reason. Okay, lay on your back, please. Oh, wow. You feel that?
Feels good.
Night and day difference, really. I want to leave it right there at that adjustment. That was a great adjustment. Go ahead and sit up. And YouTube folks, thanks for tuning in. Thanks for letting us shoot this video. And we definitely want to do a follow-up here to see how they're doing. We know that her husband had some improvements, but we're going to follow up on both of them. Again, thank you for tuning in. And if you have any questions or comments, feel free to comment below. See you soon.